There's always going to be challenges. As much as we'd love to say that everything always runs perfectly and smoothly, there are going to be challenges when integrating or moving from a system that is manual or some form of legacy system to a system like Sage 200 People. So our biggest challenge tends to be the change management side of things. And change management is really important and something that shouldn't be ignored when bringing a new system into an environment. So especially for end users, if someone has been using or been doing something manually or on a legacy system for more than a decade, it's tough for that person to change because there may be other tasks that she has to do outside of just payroll, for example. So change management is really important. Because there's going to be sometimes resistance to the change, especially when the person using the software was not involved in the decision making to change systems. The other challenge, obviously, is with regard to data migration. So when we're moving from a legacy system or from a manual system to a new system, data migration is quite a tricky one because we're very dependent on the data that currently exists. And in many legacy systems, you'll find that a lot of the data is not pertinent to the moment that we find ourselves in because we used to use those job titles 15 years ago or that department 10 years ago, and that department doesn't exist because we did some form of restructuring. So data cleanup is critical and a dependency, obviously, on the client and end user to help companies like ours to migrate the data from its original source to a Sage 200 People application. The other thing I mentioned to customers as well is that we don't want to do a lift and shift. We don't want to put something that's manual and we're just going to put it into a system. We want to use the capabilities and the power of the new system to the full extent, and that you can, have faith in the calculations that we build, in the seamless way we run payroll through this particular application. So it's important that the data that we bring over is accurate, that we migrate, but we're also making sure that the system gives you the outputs that you previously could not get from a disjointed system with multiple centers around the country. What's also sometimes which brings some kinds of complexity is the customization that is required to meet the healthcare profession specific requirements. So there are different shift patterns. There is overtime that potentially needs to be paid out. There is certain customized reports that is required, compliance rules that is specific to this particular sector. And it is important to test these things as well so that we comply not just with what was before, but actually what is. Because it does sometimes happen that when something is done manually, there can be errors that come into play, especially from a compliance perspective. And it's important for us to test that what is put into the system is 100% correct. There is no gray area. And then finally, the integration side. So Sage 200 People has great integration capabilities. And sometimes we do find that a client would like us to integrate with existing systems, which can be difficult if there is certain limitations within those existing frameworks that are in play. So it is important for anyone implementing, and having engagement with a client that they open and honest, that there's strong planning that is put in place, that there's stakeholder engagement, that sometimes introduced a phased approach to implementation, and that this all then helps to overcome the challenges when migrating systems, especially within the healthcare profession.